Hello and welcome to Coffee with Dr. Carla. I'm Dr. Carla. Harry's here with me today, and we're going to talk about some mental health related issues and hopefully kind of diminish or do away with those stigmas that surround them. So, typically, when we think of counseling, we think of I go once a week for an hour and then I get cured after whatever, and I know that a lot of my clients are like, so how many times do I have to come before I'm okay? I don't know.
Right.
There's no magic number. I refuse to answer that question. Um, And that's a really traditional way of looking at things. And it's the way that our insurance system is set up,
Right.
where you're allowed one session a day. So if you're going to see your therapist, you can't see your psychiatrist on the same day. Um, but you and I have both been exploring, mostly because you introduced the idea to me, this idea of intensives, which unfortunately insurances don't want to cover. So tell us, like, so what is an intensive? If I'm not coming once a week for however many months, what does an intensive look like, and why would I even bother doing one of those? Especially if the insurance isn't going to cover it. Holy smokes! Yeah,
Right. Right. That is the one major negative setback on intensives is that insurance doesn't cover it. But intensives is giving you a lot more time. So an example can be typically most of my intensives are 24 hours. So I'm doing 4 days, 6 hours a day, or 6 days, 4 hours a day.
right,
I've done, of course, less than that. I've done the 12 hours and we've done 2 days, 6 hours.
right.
But it's really like 3 to 6 months worth of therapy being packed into like a smaller time frame. So when you think about like if people do like an inpatient care, that's intensive therapy.
Right.
You're going and you're focused on intensive like 30 days or whatever, however many days, like that's exactly what you're working on, but it's more isolated. So you're taking yourself out of your normal and you're going in this particular facility or retreat place or whatever, and you're doing intensive therapy. It's a lot more group work,
Right.
which traditionally where I've learned it's been learned in the group setting. But I also had the experience like where you do it individually. So I focus mainly on the individual, not the couple's work of the intensive. So you're with me for this a certain amount of time, and we're focusing on whatever that is for you, whether it's
Tailor
trauma.
made.
Yeah, so
Yeah.
whether it's a trauma focus or like, because I learned it in this being a sex addiction therapist in the sex addiction realm of just like how to try to get somebody a baseline. And depending on what level a person is, like if you've just had a crisis event, more than likely that intensive work is going to bring us at a baseline. So then our hour sessions can be more productive because we've already like poured everything out on the table. It's been in a safe place, but because we're not at an inpatient setting or outpatient, like you go back into your life. Like
Right.
you're with me and then you go back. You're with me and then you go back. So it's like trying to be able to do it in a safer way. It is, I feel like it is levels to it because if certain crises, like, no, you need to go to inpatient, you need to be totally
Right.
isolated to be able to handle whatever it is. But then people at certain levels, it's like, no, we can do it here. We pour out, it's a safe container for you to be like, I don't have to worry about in this hour, like, okay, well, I told you this piece, but I can't tell you this piece because
It's too big to
it's going
open up in an
and
hour, right?
to leave after that. I open it up and now I have to leave.
And I'm all raw. And what the hell am I supposed to do between
Right.
now and next
Right.
week? Right? It's
It's
it's a
enough
lot.
time.
Yeah.
And then the other part I hear people say is like, well, what are we going to do? I'm just going to sit and talk to you for 4 to 6 hours. Like, no, we're going to do other things. So like for you, you do the EMDR. For me, I do brain spotting. And then I do like the Cartman's triangle. We do the trauma egg. It's a lot more things happening.
Right.
I've broken glass with people. We've launched balloons. It's so much more to it, but it's giving you that time frame to just like really unpack everything. And like I said, so much comes out. Like I kind of go like we might target one thing but then go a different direction because of whatever came out. But a lot of times when you're able to
Right.
sit and just focus in like that, it's like a lot more freeing for a person.
Well, and I know that when I'm doing intensives, um, you know, I'm using modalities that are much different than traditional talk therapy. Because you're right, talking 6 hours a day isn't going to get us anywhere,
Right.
right? It's also not how I work with clients anyhow. But so I'll either do NET, which is the neuro emotional therapy, or I'll do EMDR or combine them, right? And then I also will throw in art in there because the reality of it is I'm trying to get at whatever it is that we're working on,
Right.
right? But the most important part that I find, and I've heard you say this before too, is that we can get to something really icky and then we can sit there with it. We
Right.
can sit there in that uncomfortable and learn how to be okay with not being okay,
Right.
learning how to deal with all those really difficult feelings. Um, Whereas if we did the week to week, we're not going to open up enough to allow anything to happen,
Right.
right? Because that's Pandora's box,
Right.
right? And then the other thing that happens is, when you walk into a therapy session and you're going week after week, it's like, how was your week? Because you don't want to just be like, okay, bam, let's go. Let's get down to the business
Right.
here. I mean, you say, how was your week? And then sometimes you get sidetracked to something
Right.
else and you don't get to the real issue at hand, right?
Right.
But in intensive, nope, I'll ask you how your week was, leading up to it, but that's like the first few minutes. And after
Right.
that, I got you for the next, 5 hours and change, right?
Right.
And we're going to really go at it,
Right.
right? And allow all that to come to fruition. Um, so, yeah, it's really interesting. So, is there somebody who you feel like an intensive would not be good for?
Um,
Because it's easy to rattle off all the people who would be good for, but who might it not be good for?
right. Well, I think I don't think it's a thing of like who it's not good for. It's like, where are you when you're doing it? Because intensive can work for anybody.
Sure,
It's just, where are you in the moment? Like, if you're in a high crisis and you're suicidal, you need to be in inpatient care.
definitely,
But
definitely.
then when once you're, at a baseline, then yes, you can come and do it intensive. So it's like, where are you currently in the moment? More so, are you at a level where you can handle digging into whatever it is that you want to talk about and still do life at the same time? If you're at a point where it's like, I want to dig to it, but I don't think I can like go to work the next day, or go and deal with my family, or then the retreat route is the better route where you can isolate.
Right, where you can go home to your own bed and not have to worry about changing diapers or fixing a
Right.
meal
Right.
or answering
Right.
emails or whatever. Yeah.
Right. So I definitely, like, I always do an intake. So I've done intensive with my clients and people that aren't my clients. And it's like just doing the intake to figure out where that person is, to be like, okay, like, this is what we're about to do. And then we still guard that time. So I'm like, hey, you need to, when we're doing this schedule needs to be clear. It doesn't need to be drinking any alcohol. It doesn't need to be, because you need to be at your best self, because it is going to be tired. It's an intensive for a reason. So it is going to be tiring and draining. And how can you best support yourself when you leave?
Yeah, I've had clients that have been local, but I've also had clients that were in central or southern Illinois or coming in from another state, right? And so those clients have said, okay, I'm going to do, the recommendation is say 3 days intensives, and I do mine in six, in full or half day. So either 3 hours or 6 hours, right? So we got a 3 hour day. They're like, I'm going to fly in or drive in, and I'm going to get myself a hotel room, right? So they're creating the retreat atmosphere
Right.
for that time, right? Because they know that they need to get away, right?
Right.
And they need to have that time for themselves. And
Right.
a lot of my clients have even gone so far as to say, okay, well, I found a place that's going to do massages. So on the first day, I'm going
Right.
to get a massage after that, or I'm going to get my
Right.
nails done on this day, because it is about taking care of themselves as
Right.
well, right? So
Right.
it can show up in all sorts of different ways.
Right. And it's definitely like, it's definitely worth the experience to be able to do it. If you can do it, then like, let's do it. So my thing is like, if we can do that and you can isolate, then yes, we're going to do that. If you got to do it and you still got to go to work, okay, like, how do we best guard that? And so it's definitely shaped to the person
Yeah.
so that we can help support.
And this is an investment in their well-being because I'm thinking back to the client who I worked with for 3 days, right? 18 hours worth of work. I'm going to tell you the amount of work we did, it would have taken us over a year
Right.
to get through that,
Right.
right? And so in 3 days, hard days, they weren't easy, but three
Right.
hard days, she left. And the cool part is she came in with all the classic symptoms of PTSD, and she left without those symptoms, right? And they've persisted. She's been able to, continue on without them. Now, can I guarantee that? Can you guarantee that? No way. We're not saying that. But the reality is, some really hard work happens, and you can find yourself in a very different spot in life,
Right.
right?
Being able to find that baseline and then go forward in your hour sessions, like, that's what I have people now that I've done it, and we got to that baseline, and it's just like, life's still hidden, because that's life, but they've been able to, like, okay, but I know what I can pull from. At least I don't feel like I'm just swamped with things anymore. It's like, okay, I'm here and now I can actually see myself moving forward.
Right.
So,
So if you think you might be a candidate for an intensive, whether it's with EMDR, NET, or any of the other experiential modalities that we talked a little bit about today, reach out to us. We'll be more than happy to have a conversation with you. Again, like we said, you don't have to be our client. You could come in just for the intensive. We would happily report back to your primary clinician. But it's worth reaching out and getting more information about. So remember, you can change your thoughts, discover your potential, and transform your life by focusing on your overall well-being. So until next time, keep working on being the best you possible. Bye.
bye.